everyone. You are watching Eagle News America. I'm Ace Ramirez, coming to you from Washington. It's December 9, 2020. Tonight we have updates from several of our correspondents across North and Central America. Avila in Ciudad de Panama tells us about the humanitarian hub in Panama mobilizing more than 800 tons of aid to Americans. Thomas Likeness in Edmonton, Alberta.
New Year's Eve will be a lonely one this year in Alberta.
Eliza Gonzalez Manglikmot in Washington.
DC Mayor announces the latest COVID-19 restrictions relating to sports and recreation.
Milo Simbulan in Swarthmore, Pennsylvania.
Addressing opioid crisis that continues to affect Pennsylvanians during this pandemic.
Rani Bayuga in Parisburg, Ohio.
Ohio COVID-19 cases spike and Ohio antigen testing begins.
David Reggio in Oxnard, California.
LA County records highest number of COVID-19 cases since the start of the pandemic.
Darius Keobiab in Texas reports about Corpus Christi's fire department getting a $4 million upgrade in equipment, and Corpus Christi Police Department fostering more diversity in recruitment. Michael Hudson in Everett reports about Washington Governor Jay Inslee extending the state's lockdown to January 4. And for business news, Bobby Soriano reports about the U.S. labor market continuing to soften. Cisco introducing new WebEx features, and the video game industry continuing to see strong sales with the release of Cyberpunk 2077. Plus several stories for EBC Sports tonight. Miami Heat's Bam Adebayo buys a house for Mama, and the International Olympic Committee announcing the addition of new sports for the 2024 Summer Olympics. And for the virtual roundtable, we'll talk about National Pastry Day and highlight our local bakeries that sell our favorite baked goods. Our coverage begins now. First, an overview of today's COVID-19 numbers. According to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 6 p.m. Eastern Time, Wednesday, December 9, the number of cases of COVID-19 reported worldwide is now more than 68,812,000. Top 3 on the list of countries with recorded cases: U.S. has 15.3 million, India has 9.7 million, Brazil 6.7 million. More than 1,567,000 have succumbed to this virus. The U.S. leads the countries with the most number of COVID-19 related deaths, with more than 289,000. Brazil is next with more than 178,000. India is more than 141,000. The United Nations Human Rights Chief Michelle Bachelet warns that the coronavirus crisis has laid bare serious weaknesses and divisions within societies, including a destructive failure to respect basic rights. Let's take a look.
COVID-19 has zeroed in on the fissures and fragilities in our societies, exposing all our failures to invest in building fair and equitable societies. It has shown the weakness of systems that have failed to place a central focus on upholding human rights. Astoundingly, even to this day, some political leaders are still playing down its impact, disparaging the use of simple measures such as wearing masks and avoiding large gatherings. A few political figures are even still talking casually of herd immunity, as if the loss of hundreds of thousands of lives is a cost that can be easily borne for the sake of the greater good. Politicizing a pandemic in this way is beyond irresponsible. It is utterly reprehensible.
Bachelet also brings up France's proposed global security law and expressed hopes for the U.S. new administration.
urge France, as I urge many other countries, to seriously examine its law enforcement practices as well as systemic discriminatory practices and bias against certain racial groups. And of course, we urge French authorities to avoid taking action that result in the stigmatization of entire groups, and urge them also to take active steps to ensure groups are not stigmatized or have their human rights violated because of certain individuals that can make not adequate things. The law has to be discussed by, of course, by the French people, but it's the Article 24 the ones we are really concerned about, and that's what we are mentioning, that that should be reviewed and should be, I guess, withdrawn. So I hope that this new administration will bring us much better, I mean, for human rights, I think it will be much better. Now, I'm really hopeful on that.
Assistant Secretary of Defense for Health Affairs Thomas McCaffrey at a briefing on the Pentagon's plan to distribute COVID-19 vaccine doses in Washington, D.C., explains how many doses of COVID-19 vaccine the DOD, or the Department of Defense, is expected to receive.
This time, DoD is expected to receive just under 44,000 doses of the Pfizer vaccine as early as next week for immediate use. As such, and as we'll outline today, our plan will provide the COVID-19 vaccine to DoD uniformed service members, both active and selective reserve components, including members of the National Guard, dependents, retirees, civilian employees, and select DoD contract personnel as authorized in accordance with DoD policy on this topic.
Director of the Defense Health Agency, Army Lieutenant General Ronald Place, says the department is strongly encouraging everyone to take the vaccine, but that it will be on a voluntary basis.
Anticipate that this will be approved using emergency use authorization, not a fully licensed FDA vaccination. And as such, the department's policy will be voluntary for everyone. The department is strongly encouraging everyone to take it. And the reason for that, if you look at the data that are available to all of us now, that Pfizer, at least the one vendor, has made available to everyone, if you look at the safety profile of it, the safety profile is very good.
In other news, the U.S. House of Representatives approved the Pentagon budget bill Tuesday by an overwhelming majority, defying President Donald Trump's threat to veto the measure. The bill must now go to the Senate, where it is likely also to be approved before it reaches the outgoing Republican leader. The defense budget bill received 335 of 430 votes, far exceeding the two-thirds supermajority needed to override a presidential veto. Only 40 out of 196 Republicans voted against the bill. It remains to be seen whether all Republicans will maintain their stance to counter a possible Trump veto. In Central America, Panama joins global efforts to achieve higher levels of efficiency in humanitarian assistance. In Ciudad de Panama, Eagle News correspondent May Davila with more.
From hurricanes and earthquakes to volcanic eruptions and flooding, countries throughout Latin America and the Caribbean are regularly exposed to natural disasters. Panama, however, is unlike its neighbors to the east and west. The country is in a privileged position with less exposure to natural disasters. Situated along the Panama Canal, which connects the Atlantic and Pacific Ocean, the Panamanian government made use of its strategic position to assist the region during times of emergency. To help in this, the United Nations Office for Project Services has built the Regional Logistics Center for Humanitarian Assistance, or the Humanitarian Hub, to improve the capacity of governments and international agencies to respond efficiently to natural disasters and other events that will require humanitarian assistance. With this project, Panama joined global efforts to achieve higher levels of efficiency in humanitarian assistance. The Humanitarian Hub serves as a space for aid workers, humanitarian agencies and institutions, and international and national organizations to converge and work towards greater resilience in the region. The Humanitarian Hub hosts the United Nations Humanitarian Response Depot, managed by the World Food Program, as well as several humanitarian aid agencies working in the region, including the International Federation of the Red Cross and the Spanish Agency for International Development Cooperation. 2020 has been the year with the busiest activity for the Humanitarian Hub since it opened in 2018, with the COVID-19 pandemic and the different catastrophes caused by the passage of hurricanes in Central America this past few months. It has been the key in the mobilization of the different humanitarian aid in the region during this year. From this important center, more than 847 tons of international humanitarian cargo, valued at $12.3 million, have been transferred, according to Alberto Sierra, Executive Director of the institution. A document highlights that 32 countries in the Americas and the Caribbean have benefited from the role of the Humanitarian Hub, receiving 326 tons of personal protective equipment to combat the pandemic. These deliveries are made through its international users, the International Federation of the Red Cross and Red Crescent, and the United Nations Humanitarian Response Depot, by air, sea, and land. During this pandemic, Panama has put its infrastructure at the service of the world, keeping the maritime routes served by the canal operational, guaranteeing the continuity of all supplies, especially food and medicine. One of the objectives of the Humanitarian Hub is to have the capacity to bring humanitarian aid to those affected in a period of 24 to 48 hours after a disaster. And from Panama, it is possible with an effective public-private collaboration to provide these logistical services to these international organizations. Desde Ciudad de Panama, May Davila, Eagle News. Vivimos en tiempos interesantes.
When we come back, updates from our Eagle News correspondents in Edmonton, Alberta, and Washington, D.C. This is Eagle News America. Stay with us.
Factual.
We have to defeat the virus everywhere.
Timely information. Balanced, not only in the country, but also abroad.
I'm certain of one thing.
Interviews that people need to know. Watch Aguila Pilipinas, a one-hour newscast of reports coming from regional hubs in Luzon, Visayas, and Mindanao. Know the important updates in Asia in ASEAN in Focus. Track the latest stories in the provinces in Aguila Provincia. Tune into Mata ng Agila, the evening primetime news program of Net25. Balanced and objective, Mata ng Agila covers national and international issues, tackles news on business, health, science, and technology, entertainment, sports and human interest features, and current events. And Eagle News International delivers the latest global reports, impartial, accessible, and up-to-date. It brings to fore EBC's rich international scope and access to valuable information streams.
Well, thank you to Thanks our help outdoor chat.
Catch these programs on Net25. You can also watch our news programs through eaglenews.ph and Eagle News Facebook page and YouTube channel.
Kumanta, sumaya tayong lahat. Saya-saya.
Sa pagsasara ng mga bansa sa panahon ng pandemya, isang bayan ang magbubukas ng kanyang pintuan.
Miss Reyna, kakausapin daw po kayo ni Mr. Dalmundo.
Pabalik sa isang kahapong ayaw ng balikan.
Yes, Mr. Dalmundo.
Alam naman ng kuya mo kung saan nahanapin yung mga bagay dito. Di pa naman nagbabago yung hotel since the last time he worked here.
Kuya, nagtrabaho ka dito? Ba't hindi ko alam yun?
Muling mabubuhay ang mga alaala.
Tayo mag-housekeeping, security, cook, tapos magbabayad tayo ng doble. Win-win!
Paano na yung hotel natin? Naisara niyo bang mabuti? Yung mga staff, napauwi mo na ba? Naku, paano na yung mga guest natin sa hotel?
Gusto ko lang muna sanang kumonsulta tungkol sa sitwasyon ko ngayon. Yung kapatid ko kasi, pumasok siya into an agreement with the hotel owner. Wala pa kasi siyang 18.
Problema nga yan, ng hotel. Which hotel, by the way?
Iisa lang naman ang hotel dito sa Olvida.
Seryoso ba? Itidemanda niya ako?
Pagmamahal.
Ang daigdig ko'y ikaw. Tuwing Sabado, 8:00 ng gabi, dito lamang sa Net 25.
Innovation, digital disruption, globalization. Startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business every Saturday from 5 to 6 p.m. Open for Business, from vision to action.
America, I'm Ace Ramirez in Washington. It will definitely be a different holiday season this year, and that includes our New Year celebrations. In Alberta, it just might be a not-so-hot, happy 2021. In Edmonton, Bureau Chief Thomas Likeness tells us why.
Thank you, Ace. Thank you, Ace. As we draw close to the holiday season, Alberta's Premier has dropped the hammer. Tough restrictions are coming in an attempt to slow the spread of COVID-19, and they'll be in effect until sometime in January. That means the holiday season essentially has been scrapped. The ban on social gatherings has been extended to include outdoor socializing, so you can't stand around a winter bonfire with your neighbors anymore. As well, there's a mandatory mask bylaw in place in the province. Face masks required in all indoor places, including shopping malls. Premier Jason Kenney said he had no choice but to get tough. COVID-19 has backed him into a corner. The curve is anything but flat. In Alberta, the numbers just keep increasing. You know, we're a province of only 3.5 million people, and we're posting new case numbers in excess of 1,700 a day. The death rate goes up as well. We've recorded more than 650 deaths in the province since the pandemic began, but get this, the number of deaths has doubled in the last 4 weeks. More than 300 deaths in 30 days. Every hour or so, someone in the province falls victim to COVID-19. Time for action, and Premier Kenney's government has decided to listen to the experts. Healthcare workers, nurses, doctors, well, they've all been calling for more restrictions for several weeks now, and Kenny has finally delivered. The severe restrictions now affect retailers. They go into effect on Sunday. The number of customers cannot exceed 15% of the capacity of the store, and that will apply to shopping malls as well. People have also been told, don't congregate in shopping malls. Don't bend the rules and try and get around them by just getting together in a shopping mall. That's not allowed. Restaurants, bars, cafes, food courts, they all have to become takeout operations now. Dining in is prohibited. And businesses have been told that workers who have to be on site can report to the workplace. Everybody else, stay home and work from home. Just how long is this going to last? Kenny says at least 4 weeks. And that's going to make for a very different holiday season this year because there'll be no celebrations, no family get-togethers, and forget about ringing in the new year with friends like we have in the past. Kenny, for his part, well, he's not apologizing for this move.
Here is the hard truth. Clearly, the biggest single source of viral transmission is at home gatherings. It's when we let our guard down. It's when we relax with people that we are close to. And it's when transmission most easily happens. And so if we relax the public health measures to permit large family gatherings in just 3 weeks' time, we will, without a shadow of a doubt, see a large increase in hospitalizations and fatalities.
The situation is serious. Hospitals are admitting scores of patients every day for COVID treatment. There's even talk of the military being deployed in Alberta to help with the pandemic. They'll likely be in long-term care centers to give some relief to the staff there. So with all of this, people will be ringing in the new year pretty much alone, at home with only those who live in their household. Kind of a fitting end to a calamitous year. In the meantime, while we wait for all of this to end, I wish you all good health. Remember to take care of others, take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Ace.
Thank you, Tom. 4 weeks of restrictions. It's sad, but it's for the better. But the question is, do these measures work?
Yeah, very, very definitely is necessary, but I kind of wonder if we're a day late and a dollar short, you know. We should have been doing this 2 or 3 weeks ago. That's when healthcare officials were calling for this. People said the half measures introduced then just didn't go far enough. And a large segment of the public and the business community even said, you know, please shut us down so we can get government aid. You know, one of the big problems is that more than 80% of the people with active cases don't know where they got the virus. Our contact tracing is so far behind. So these closures and limits on retail will certainly limit the number of contact points. What remains to be seen is how compliant people will be over the holiday season, and that will be the determining factor in just how much of the infection will spread in January. Ace?
Talking about that spreading and the surge, how about the healthcare people? How are they taking these developments?
Well, most of them are relieved now with the introduction of these new measures because they've been calling for them. But some doctors are worrying about enforcement. Will the government follow through? It's one thing to make a law, then you've got to enforce the law. They do applaud the mask mandate. That's been a long time coming. It had been left up to individual municipalities. Now it's province-wide. You know, hospitals have been pushed to the limit. 60% of the non-urgent surgery in Edmonton has been canceled. They just don't have the capacity to do it. Staff is burning out. For weeks, they've been saying something has to be done. Now that the tough measures have been announced, there's a sense of relief. But again, the key is compliance. I want to give the last word, as I always do, to our Chief Medical Officer of Health, Dr. Dina Hinshaw, and I'll just quote her here. She says, for the time being, we must be the vaccine for each other. Ace?
Exactly. Thank you so much, Thomas Likeness from Edmonton, Alberta.
Thank you,
Now
Ace.
we head over to the capital, where the DC mayor announces modified requirements for physical activity. In Washington, Eliza Gonzalez Manglikmot is with us this evening. Eliza.
Thanks, Ace. Good evening to you, and wishing our viewers in the Philippines a wonderful Thursday morning there. That's correct, Ace. It's sad, but it's necessary. In response to the escalating transmission of the coronavirus disease in the district, modified COVID-19 restrictions relating to physical activity have been ordered by the Office of the Mayor, Muriel Bowser. High-contact sports, these are basketball, boxing, football, hockey, lacrosse, martial arts, rugby, soccer, and wrestling are, for now, prohibited in DC, except for university or professional leagues who may continue organizing and administering practices and competitions for athletes who engage in high-contact sports, provided that it is done pursuant to a health and safety plan approved by its governing body and under such conditions as may be imposed by the HSEMA or the Homeland Security and Emergency Management Agency. Now, existing DPR permits or Department of Parks and Recreation permits may be used for non-contact drills and workouts only for youth younger than high school aged. Youths in middle school and younger may continue to participate in organized drills and clinics for high-contact sports only if the athletes are in groups of no more than 12 and do not mix with other groups. And those within the same group must still maintain social distance from each other and their coaches. These activities must not involve any actual physical contact with one another. Now, for high school sports restrictions, high school extracurricular sports activities and competitions are suspended for DCPS, public, charter, private, and parochial schools. Now, ACE recreation centers and sports clubs shall also suspend sports and organized athletic recreation activities, including practices, clinics, and competitions for high school athletes. Now, other miscellaneous restrictions may be found on coronavirus.dc.gov. The effective date and duration of this order starts this Friday, December 11 at 12:01 a.m. until December 31st of this year, or depending on the extension of the COVID-19 public health emergency, whichever is later. Now, for some weather update, it is now 44 degrees Fahrenheit or 7 degrees Celsius here in the nation's capital. In Washington, Eliza Gonzalez Manglikmot, Eagle News, will live in interesting times. Back to you, Ace.
Eliza, my daughter Iris is asking me, bugging me about this. She does club volleyball, so she's if the season will be halted because of this. But you mentioned organized athletic recreation activities for high school. Would that be suspended too?
Yes, they will be suspended, and these activities, Ace, they pertain to, but not limited to, Zumba, group workouts, yoga classes, jazzercise, and the likes. So even if you say you'd keep a 6 feet distance while dancing, it is not allowed this time. And although the order pertains to, like what was mentioned in the announcement, high school age athletes, I think it will be safe to assume that it is discouraged as well for others who may not be high school aged, but also engage in these types of athletic recreation activities. So I guess it's back to workouts on video for now until, we get a go signal from the authorities that it is safe again to engage in these group activities. Ace?
Right. Heartbreaking, but it's needed. All right. Thank you so much, Eliza Gonzalez Manglikmot from Washington. Up next, updates from Pearisburg, Ohio, Swarthmore, Pennsylvania, Oxnard, California, and Corpus Christi, Texas. Oh, and Everett, Washington. Eagle News will return shortly.
Pare, bilisan mo! Mag-alas 12 na!
12 na! Tara na!
Excuse me, patangan alas 12 na!
Yung confidence mo, ramdam namin dito.
You should be proud of yourself. Binuhos mo lahat.
Natutuwa ako sa ginawa mo. Talagang lahat kami ay na-amaze sa iyong galaw.
The search continues para sa maghaharap-harap sa ating first monthly finals ngayong second quarter ng ating kompetisyon. Who will bring the heat dito sa ating TNG stage ngayong taglamig? Malalaman natin sa Tagisan ng Galing Part 2 Dance Edition.
Hey there, Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net25.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced, eagle news, because we live in interesting times.
Sila ang mga kinikilalang bayaning may mahalagang papel para makamit ang kalayaan at pagbabago sa Pilipinas. Pero sa panahong ito, may mga bagong bayaning nakikipaglaban sa sakit na lumaganap sa buong daigdig, ang COVID-19. Ang ating mga frontliner, gaya ng healthcare workers, mga doktor, nurses, medical technologists, at iba pang health professionals, mga pulis, sundalo, security guards, mga tauhan na nangangalaga sa seguridad at mahahalagang pangangailangan ng bawat komunidad. Ang mga bagong bayani, ating pasalamatan. Kilalanin ang kanilang sakripisyo at serbisyo para sa lahat.
It says the best defense is still containment.
We are in uncharted territory.
Final volume for UK. If I want to 100%. Traffic ban. Consumption eh.
The search for the best continues. Tagisan ng Galing Part 2 is now accepting audition entries. If you are 21 to 59 years old and have what it takes to be the next Tagisan ng Galing Grand Winner as a solo performer, duet, trio, band, or grouped act, submit your audition entries now. Just follow these guidelines. To submit audition entries for the singing category, contact Nikki at 0977-651-9504. This is your chance to be Tagisan ng Galing's grand winner and win 2 million pesos. For more details and updates, visit and like the Tagisan ng Galing Facebook page. What are you waiting for? Join now!
Sa mundong waring walang puwang para sa kanilang pagmamahalan, sapat ba ang tibok ng kanilang mga puso upang bumuo ng daigdig nilang sarili? Inihahandog ng Eagle Broadcasting Corporation ang kauna-unahang romantic teleserye ng Net25. Ang daigdig ko'y ikaw. Tuwing Sabado, 8:08 ng gabi, dito lamang sa Net25.
At ako'y laging sa'yo hanggang magpakailanman.
Sanay na sanay eh. Pro na pro. And yung mga birit ng yung mga high notes, na talagang you're hitting it really well.
I can already pronounce you na talagang you are real performers.
Wow na wow.
I like your performance, okay?
And loving you.
Bakan sa kantahan dito lang po yan sa Tagisan ng Galing Part 2 Singing Edition.
Impormasyong mahalaga sa taong bayan. Patas na pagbabalita. Papakinggan ang magkabilang panig. Lilinawin ang mga issue at kaagad na ihahatid ng objektibo. Mata ng Agila. Dumadagit ng pinakasariwang pangyayari, hindi lamang sa loob ng bansa, kundi sa iba't ibang panig ng daigdig. Mula sa Eagle News Teams at sa tulong ng makabagong teknolohiya, tiyak na makakalap kaagad ang katotohanan. Para sa mas matalas, malinaw at malalimang pagbabalita. Ito ang mas pinatalas na Mata ng Agila. Inihahatid ng veteranong broadcast journalist na si Eli Saludar. Kasama si Binibining Pilipinas Intercontinental 2019, Emma Tiglao. At pinangungunahan ng batikang mamamahayag ng bansa, Vic De Leon Lima. Mata ng Agila, Lunes hanggang Biyernes, alas 6 hanggang alas 8 ng gabi, dito sa Net25.
You're watching Eagle News America. I'm Ace Ramirez in Washington. The opioid crisis that has been categorized as a public health emergency never really went away during this time of pandemic. In fact, it may have worsened. It is one of the many concerns the state of Pennsylvania is trying to address. Alongside efforts of curbing the further spread of the pandemic, the state is also trying to address the pandemic's impact on the opioid epidemic. Swarthmore, Bureau Chief Maya Lasimbulan has the details.
That's right, Ace. December is typically a challenging month for many who struggle with the disease of addiction. With the need for people to social distance and avoid gathering due to COVID-19, Pennsylvanians who have struggled with the disease of addiction may be at increased risk of relapsing this year. Here's Deputy Secretary of Health Preparedness and Community Protection and Opioid Command Center Incident Commander Ray Barishansky to tell us more. Take a look.
I cannot emphasize enough that these people are affected by a disease, and that disease is the disease of addiction. We have come so far in reducing the stigma surrounding overdoses and those with the disease of addiction, but we still have so much further to go. The impacts of COVID-19 highlight the work that still needs to be done. We have a strategic plan in place at the Command Center that will guide us through the next 2 years as we continue to fight this epidemic. We know that with the holidays of Christmas, Hanukkah, Kwanzaa, and various others approaching, It can be a difficult time for those struggling with this disease. And due to COVID-19, this year could be even more difficult.
Work to address the opioid crisis focuses on 3 areas: prevention, rescue, and treatment. Efforts over the past several years working with state agencies, local, regional, and federal officials have resulted in significant action to address the opioid crisis. These are just some of the programs or tasks launched to fight this crisis. First, Secretary of Health Dr. Rachel Levine signed an updated naloxone standing order, permitting community-based organizations to provide naloxone by mail. The Prescription Drug Monitoring Program has reduced opioid prescriptions by 47% and has virtually eliminated doctor shopping. Another one is the number of people receiving high dosages of opioids, defined as greater than 90 morphine milligram equivalents per day, has dropped 57% since the PDMP launch in August 2016. The Opioid Data Dashboard was also launched, and Data Dashboard 2.0 that has provided public-facing data regarding prevention, rescue, and treatment. Also, education and training on opioids have been provided to schools. Future plans are in place to make opioid education a standard component of school-based training. In September, DDAP announced the launch of Life Unites Us, an anti-stigma campaign utilizing social media platforms to spread real-life stories of individuals and their family members battling substance use disorder. Live and recorded webinars detailing tools and information necessary to effectively reduce stigma to more than 350 community-based organizations focused on SUD prevention, treatment, and recovery throughout Pennsylvania, and a web-based interactive data dashboard detailing the progress of the campaign. Here's Department of Drug and Alcohol Program Secretary Jennifer Smith to tell us more. Take a look.
The honor of announcing the launch of our innovative behavioral change project, Life Unites Us. Life Unites Us is a unique partnership between the Wolf Administration, Penn State University, and national partners, Shatterproof and Public Good Projects. Together, we are spearheading the country's first state-driven, proven behavioral change campaign to effectively reduce stigma across the Commonwealth. So what does that mean for Pennsylvanians? Well, we know that stigma exists for individuals with substance use disorder. Stigma keeps people from reaching out. It permeates into workplace policies and into our communities. In some cases, stigma even exists within the substance use disorder recovery community, where those who use medication are often the target of stigmatizing attitudes.
Even during this pandemic, Pennsylvania's drug and alcohol treatment providers are open and operational. If people are deciding whether to take that first step, brave step, there is absolutely no shame in seeking help to lead a happy, healthy life. Ending addiction stigma means saving Pennsylvania lives. In Swarthmore, Pennsylvania, Myla Simbulan, Eagle News. We live in interesting times. Back to you, Ace.
Thank you, Myla. Can you tell us more about this naloxone and how does one get it? How does one secure naloxone?
So naloxone is a medicine that rapidly reverses an opioid overdose. It is right now. It is carried at most here in Pennsylvania. It is carried at most pharmacies across the state year-round. Naloxone is also available to pharmacies, to many pharmacies with public and private insurance, either for free or at low cost. And it's also have been made available through the Pennsylvania Commission on Crime and Delinquency Centralized Coordinating Entities. Free public naloxone giveaways at Pennsylvania health centers. It's also there's also partnerships with Pennsylvania colleges and universities and distribution to narcotic treatment providers throughout the state or the Commonwealth.
I see. So it's a pill or a capsule.
Yes.
I see. Okay. Is there a toll-free number that they can call if they are in need of help?
The Department of Drug and Alcohol Programs, they have this toll-free helpline that connects callers looking for treatment options for themselves, or if you have a loved one, resources in their community. So the toll-free is 1-800-662-HELP. And this helpline is available 24/7, and that includes holidays. There's also an anonymous chat service that offers the same information to individuals who's not, sometimes they're not comfortable talking on the phone, and that's available on www.ddap.pa.gov. Ace?
Thank you, Myla. Great information. Stories from Ohio tonight. The state sees a spike in COVID-19 cases, with several counties now in public emergency level. Meanwhile, antigen testing begins in the Buckeye State. In Parisburg, Randy Bayuga joins us this evening. Randy.
Thank you, Ace. Since the start of November, the backlog of unconfirmed COVID cases finally cleared yesterday, adding an additional approximately 13,000 new confirmed cases to yesterday's 24-hour total, a new record of 25,721 new confirmed cases added in a 24-hour period, bringing Ohio's grand total to rise above 500,000, now at 520,112 confirmed cases and deaths at 7,187, while presumed recovered at 351,268. Today, an additional 10,094 new cases, along with 464 hospitalizations, 49 additional admissions to ICU, and an additional 84 deaths. ICU now holding 5,059 patients. Of the 88 counties in Ohio, 8 are now in public emergency level 4. Doubling just in a week. And the first county to be added to public emergency level 4, Franklin County, was downgraded today to public emergency level 3. The latest surge can also be attributed to the Thanksgiving holiday. Hospitals are beginning to be heavily challenged as new cases arrive, and Governor Mike DeWine is now looking to extend the curfew, which will expire this Thursday, to an additional week or so. We will find out more tomorrow. Ohio is expecting the first Pfizer vaccine batch to arrive next week. The initial batch will be sent to the 10 hospitals selected to distribute and also store the vaccines. And potentially 88,724 doses may be shipped to local Walgreens and CVS pharmacies to start the distribution. Nursing homes and other long-term care patients will be the first to receive the vaccines. Starting today, the Ohio Department of Health will begin including antigen testing for verification of COVID-19 cases. Antigen test is a faster test to confirm if a person has COVID-19, but a higher chance of missing an active infection where the body has not yet produced an immune response. A positive antigen test for COVID-19 may state that you have or had COVID-19 infections before. The addition of the test is due to the change in CDC guidelines back in August, allowing the use of antigen testing data to be added to probable case without verification. Due to surge in cases, manual verification process for antigen testing was too slow and tests could not keep up. But Ohio will continue to manually confirm each antigen test before adding them to confirmed cases. In Ohio, labs are processing about 12,000 antigen tests per day. Antigen tests have become a bigger part of our overall picture of understanding COVID-19, and it's important to capture that information, according to Governor Mike DeWine. In the coming weeks, as backlogs are cleared, The antigen tests will be added to key indicators to add to confirmed cases. Perrysburg, Ohio, Eagle News, Ronnie Bayuga. We live in interesting times. Thank you, Ace.
Randy, thank you. What are the actions being taken by the schools to deal with the COVID-19 surge?
Well, you know, the schools have recently, well, before the mid-start of November, started to have full in-person classes. But what happened is the escalation of the COVID-19 cases, many have recanted. So currently there are now 29% of school districts in Ohio that are fully in-person learning, 25% are in partial or hybrid learning, and 44% full remote learning. 2 districts actually in Ohio are closed all completely. Because of the surge in the communities themselves, many schools have backtracked to remote or full remote or partial learning. My son actually, they've actually added Zoom classes so that they can actually have the teacher online instead of just having e-learning class. So there's a lot of things, adjustments being done by the schools.
Good to know. Thank you so much, Randy Bayuga, Perrysburg, Ohio.
Thank you, Ace.
Infection surge. Los Angeles County sees its highest number of coronavirus infections to date. Oxnard, David Reggio has the detail.
Thank you, Ace. Los Angeles records 8,000 COVID-19 deaths and surpasses 3,000 current hospitalizations throughout the county. It is a milestone for Los Angeles County, but a tragic one, when the LA Public Health Department released the statistics yesterday of an additional 8,547 new COVID-19 cases and 64 deaths. The total to date is 466,321 positive cases and 8,000 deaths. Public health officials announced that the 5-day average of daily positive cases is now 8,993, which is twice the number seen just a week and a half ago. These are the highest new numbers of coronavirus cases ever recorded in the county since the beginning of this pandemic. COVID-19 hospitalizations are also quickly rising. There is now a total of 3,113 people currently hospitalized due to the virus, with 24% of them in the intensive care unit or ICU. This is a rapid increase of almost 1,000 additional hospitalizations compared to about a week ago when the number of hospitalizations was at 2,185. Barbara Ferrer, Public Health Director, states, quote, "I know we all want this to be over, but the only way we can truly move on forward in our recovery journey is if we all follow the basic public health safety measures. Right now, too many people in our community are infected with COVID-19, and it is irresponsible and dangerous for people or businesses to flaunt the essential measures that protect everyone from transmitting or acquiring the virus. The way out of this may seem difficult, but the steps are simple. And those who disregard these safety measures are only delaying our recovery journey." End quote. Hispanics and Latinos continue to be the ethnic group greatly impacted by the coronavirus, as they comprise almost half of Los Angeles' estimated 10 million population, accounting for approximately 38% of the total positive cases and almost 49% of the total COVID-19 deaths. In Oxnard, California, David Reggio, Eagle News. We live in interesting times. Back to you, Ace.
David, that report on the record high COVID-19 deaths and hospitalizations should alert all residents there to strictly adhere to all the required precautionary measures. Are there any updates today on these COVID-19 numbers?
Well, Ace, the COVID-19 statistics released this afternoon continue to be very bleak. The Los Angeles Public Health Department records an additional 9,243 positive cases with 75 new deaths. Public health officials also announced a new record high of COVID-19 hospitalizations with 3,299 people in hospitals. To date, Los Angeles County now has a total of 475,271 positive cases and 8,075 deaths. It is indeed more urgent that Angelenos strictly follow the health orders and instructions from the Public Health Department in order for Los Angeles County to win this battle against COVID-19. Ace?
Thank you so much, David Reggio from Oxnard, California.
Thank you so much.
When we come back, business news with Bobby Soriano. This is Eagle News America. Stay with us.
It's time to take one step further and face the impossible. Time to search the unknown and fight for the truth. Time to overcome boundaries and connect the world. It's time for DW News.
Several stories from our business desk today. Bobby Soriano with the details.
Good evening. U.S. markets have closed. Here are your latest business headlines. Newly released data is suggesting that the U.S. labor market continues to soften as we approach the winter months. According to data from job search website ZipRecruiter.com that was shared with the Wall Street Journal, there has been a decrease in posted online job listings, from 10.9 million in October down to 10.7 million in November. This is on top of job growth slowing down significantly between the months of October and November, where employers added only 245,000 jobs in November versus the 610,000 in October. The Labor Department also reported today that there were seasonally adjusted 6.7 million available jobs on the last business day of October, compared to 6.5 million in September and 7.3 million a year prior, which is still all well below the 11.1 million people who were unemployed for the month. Certain industries were seeing an increase in hiring, with data from ZipRecruiter showing 2.5 times more ads for jobs in warehousing and the U.S. Postal Service, as well as twice as many positions for home childcare. The battle for your video conference attention continues on, as Cisco released new features this week for its WebEx video conferencing platform. These new features were introduced as Cisco attempts to fend off fierce competition in the video conferencing space from the likes of Zoom, Facebook, Google, and Microsoft. Online meetings have become an absolute necessity for many businesses, schools, and religious organizations in order to continue their operations at a time when people throughout the world are stuck at home during the pandemic. These new features follow Cisco's recent acquisition of 2 startup companies who have made investments into solutions that look to help increase work-from-home productivity. Lastly, while some companies are hoping to increase your productivity, others are looking to profit from your leisure time. The video game industry has all heads turned towards tonight's release of CD Projekt's Cyberpunk 2077, the company's first major release since its 2015 critically acclaimed Witcher 3. Cyberpunk has been in the headlines previously for being delayed multiple times, with more recent delays being attributed to the struggle of the Polish company's employees having to complete the game from home during the pandemic. But expectations continue to remain high for the game, as it is the only AAA original title coming to market this holiday season. The home entertainment industry as a whole has done very well throughout the year, and analysts are projecting that the release of Cyberpunk will net CD Projekt over $1 billion in sales just in its first month alone. U.S. markets closed in the red as investors continued a wait-and-see approach on the ongoing stimulus talks. Reporting from New York, Bobby Soriano, Eagle News, we live in interesting times.
I'm not a big gamer, but that Cyberpunk 2077 looks great and something to look forward to. We continue to express our appreciation for our healthcare workers, first responders, and essential workers. You are our modern-day heroes. That is today's Eagle News America. Thank you for joining us. I'm Ace Ramirez. We live in interesting times.